If you have been feeling exhausted for no clear reason, constantly thirsty, hungry soon after eating, or waking up several times during the night to use the bathroom, your body may be trying to warn you about something serious. High blood sugar often develops quietly. Many people ignore the early signs because they seem harmless or unrelated to one another. The danger is that elevated blood sugar can slowly damage blood vessels, nerves, organs, and eyesight long before a person is officially diagnosed with diabetes. The good news is that your body usually sends warning signals early. Learning to recognize these signs can help you take action before more serious complications develop. Today, we're going to uncover some of the most important warning signs that may indicate your blood sugar is too high, along with several symptoms commonly linked to diabetes. By understanding what your body is trying to tell you, you can make informed choices and protect your long-term health. One of the earliest and most noticeable signs of high blood sugar is frequent urination. While drinking a large amount of water before bedtime can naturally make you wake up during the night, constantly needing to urinate may signal something more significant. When blood sugar levels rise, the kidneys work harder to remove excess glucose from the bloodstream. To do this, they pull more water into the urine, causing you to visit the bathroom more often. If this happens regularly, especially at night, it may be worth paying closer attention. Another common warning sign is persistent thirst. Frequent urination causes the body to lose fluids at a faster rate than normal. As dehydration develops, your brain responds by creating a strong urge to drink more water. This can become a frustrating cycle where you drink more because you're thirsty, but continue to urinate because your blood sugar remains elevated. If you constantly feel thirsty even after drinking enough fluids, your body may be signaling that something is out of balance. Blurred vision is another symptom many people don't immediately connect to blood sugar levels. When glucose levels become too high, fluid shifts can occur inside the eyes. This may temporarily change the shape of the lens, making it difficult to focus properly. Objects may appear blurry, and reading small text may become more challenging. Some people assume they simply need stronger glasses, but fluctuating vision can sometimes be related to changes in blood sugar rather than permanent eyesight problems. Difficulty concentrating is another warning sign that often goes unnoticed. Your brain relies on a steady supply of energy to function efficiently. When blood sugar regulation becomes impaired, cells may struggle to use glucose properly. At the same time, dehydration caused by frequent urination can affect mental performance. Many people describe this as brain fog, difficulty focusing, forgetfulness, or feeling mentally sluggish throughout the day. A dry mouth can also be linked to high blood sugar. Reduced hydration combined with changes in saliva production may leave your mouth feeling sticky or uncomfortable. Some people notice increased thirst alongside persistent dryness, while others may experience bad breath or a greater risk of oral health issues. Because saliva helps protect the mouth from bacteria, chronic dryness should never be ignored. Men may sometimes experience erectile difficulties when blood sugar remains uncontrolled for long periods. Elevated glucose levels can damage both nerves and blood vessels. Healthy circulation and nerve function are important for sexual health, and long-term blood sugar problems can interfere with both. While many factors can contribute to this issue, blood sugar control is an important consideration. Recurring infections may also serve as a warning sign. High glucose levels can create an environment that allows bacteria and fungi to thrive more easily. In addition, elevated blood sugar may weaken certain aspects of the immune response. As a result, some individuals experience repeated infections that seem difficult to fully eliminate. Frequent infections should always be discussed with a healthcare professional, especially when they occur alongside other symptoms of high blood sugar. Slow healing cuts and wounds are another important clue. Under normal circumstances, your body repairs damaged tissue through a complex healing process involving circulation, immune cells, and nutrients. Elevated blood sugar can interfere with this process. Reduced circulation and nerve damage may slow recovery, causing cuts, bruises, and scrapes to take longer than expected to heal. If minor wounds seem unusually stubborn, it may be time to investigate the underlying cause. Digestive discomfort can also occur when blood sugar remains elevated. Some people experience bloating, nausea, stomach fullness, abdominal discomfort, or occasional vomiting. High blood sugar may affect the nerves that help control digestion, slowing the movement of food through the stomach. This can create uncomfortable symptoms that are often mistaken for ordinary digestive issues. Constant fatigue is one of the most common complaints among people with high blood sugar. Even after getting enough sleep, they may feel drained, sluggish, or lacking energy throughout the day. The reason is simple. Although glucose is present in the bloodstream, it may not be entering cells efficiently where it can be used for energy. The result is a feeling of exhaustion, despite having plenty of fuel available. Dry and itchy skin is another possible sign. Healthy skin depends on good circulation and adequate hydration. When blood sugar remains elevated, dehydration and circulation problems may contribute to itching, particularly in the lower legs and feet. Skin may become rough, flaky, or irritated without any obvious explanation. Many people are surprised to learn that increased hunger can also be associated with high blood sugar. After eating, food is normally converted into glucose and transported into cells for energy. When this process becomes impaired, cells may signal that they still need fuel, even though plenty of glucose is already present in the bloodstream. This can leave a person feeling hungry again shortly after finishing a meal. Excess fat around the abdomen is frequently associated with blood sugar problems. Carrying extra weight around the waist can make it more difficult for the body to respond effectively to insulin. Over time, this may contribute to rising blood sugar levels and increase the risk of developing diabetes. While body weight alone does not determine health, abdominal fat is often considered an important warning sign. Nerve-related symptoms should also be taken seriously. High blood sugar can gradually damage the tiny blood vessels that nourish nerves throughout the body. As nerve function becomes impaired, people may experience unusual sensations, discomfort, or reduced sensitivity. These changes often begin gradually and become more noticeable over time. Changes in the skin can provide additional clues. Some individuals develop areas of darker, thicker skin, especially around the neck, under the arms, or in skin folds. These changes may be linked to insulin resistance and should not be ignored. Skin can often reveal important information about what is happening inside the body. Tingling and numbness are among the most recognizable symptoms associated with prolonged high blood sugar. Many people describe a pins and needles sensation in the hands, feet, fingers, or toes. Others notice numbness or reduced sensitivity. These symptoms may result from nerve damage that develops when blood sugar remains elevated for long periods. Now let's discuss several symptoms that are commonly associated with diabetes itself. One of the biggest warning signs is a combination of fatigue and hunger. Your body converts food into glucose, but glucose must enter cells to provide energy. Insulin helps make this possible. When insulin is insufficient, or when cells become resistant to its effects, energy cannot be used efficiently. As a result, you may feel tired and hungry at the same time. Frequent urination remains one of the hallmark symptoms of diabetes. As blood sugar rises beyond normal levels, the kidneys attempt to remove excess glucose through urine. This process requires additional water, leading to more trips to the bathroom and a greater risk of dehydration. Unexpected weight loss can also occur. Although some people struggle with weight gain, others experience unexplained weight loss despite eating normally. This happens because the body may begin breaking down fat and muscle for energy when glucose cannot be used efficiently by cells. Combined with calorie loss through frequent urination, weight reduction can become noticeable. Dry mouth often accompanies diabetes-related dehydration. As the body loses more fluids, moisture becomes limited throughout the body, including the mouth. This can create discomfort, increase thirst, and contribute to oral health concerns. Vision problems should never be overlooked. High blood sugar can affect delicate structures within the eyes. While early vision changes may be temporary, long-term uncontrolled blood sugar can increase the risk of more serious eye complications. Regular eye examinations are an important part of maintaining overall health. Poor wound healing is another symptom that deserves attention. Reduced circulation and nerve damage can make it difficult for the body to repair injuries efficiently. Even small cuts should be monitored carefully, particularly when they occur on the feet or lower legs. Tingling, numbness, or discomfort in the hands and feet can become more pronounced as diabetes progresses. These symptoms often develop gradually and may worsen if blood sugar remains uncontrolled. Early recognition is important because addressing blood sugar levels may help reduce further damage. Dark patches of skin, particularly around the neck and underarms, can be another warning sign. These areas may appear thicker, darker, or velvety in texture. While skin changes can have many causes, they are commonly associated with insulin resistance and should be evaluated by a healthcare professional. The encouraging news is that high blood sugar and diabetes risk are not determined by a single factor. Daily habits play a powerful role in overall health. Eating more whole foods, reducing heavily processed foods, staying physically active, managing stress, maintaining a healthy weight, getting enough sleep, and keeping up with regular medical checkups can all support better blood sugar control. Small improvements practiced consistently often create meaningful results over time. Most importantly, do not ignore the signals your body sends. Frequent thirst, unexplained fatigue, blurred vision, slow healing wounds, numbness, digestive problems, recurring infections, and unusual skin changes are all messages worth paying attention to. The earlier blood sugar issues are identified, the greater the opportunity to take positive action and protect your health for years to come. If you found this information helpful and want more evidence-based health tips that can help you live longer, feel better, and stay healthier as you age, make sure you subscribe to Dr. Grace Longevity and turn on notifications so you never miss our future videos.